their conception in 1965, community health centers have created affordable healthcare options for more than 30 million people. Aiming to increase access to those who often find barriers to quality care, community health centers operate and advocate in underserved and rural communities.
Community Health Center is an organization that is community-based as well as patient-centered. The majority of the people that run our organization as board members must use our services. So they truly are making decisions on behalf of all the patients that we serve. The reality is that over 30 million people are struggling to get adequate health care. Access, affordability, reduction of barriers like transportation, rural resources, language barriers, those are the people that need our care the most. And so that's a very, very important aspect of healthcare in America these days.
My dad came over in 1992 from China, and my mom 2001 from China, and they're just first-generation immigrants. They used to live in New York for a little bit, but when they came to Florida, I'm pretty sure, yeah, they've always gone to Treasure Coast. You know, they used to be low income, so they accepted I think it was Obamacare or Florida Kid Care, I'm not too sure about the insurance. So they always accept that type of, the low income insurance, so that's the main reason they came here. They chose to stay because they like it here, Service is good, they always call about appointments, stuff like that.
Now more than ever, healthcare is viewed through a comprehensive approach, encouraging different sectors of healthcare to communicate to ensure the optimal treatment of their patients. The Community Health Center model promotes an inclusive healthcare environment.
Healthcare professionals are finding that it's impossible to take care of just one organ as we used to believe, with the emphasis initially on hearts and then lungs and other medical reasons. We found that there's overlap. For example, a diabetic that neglects their oral care will have more problems with their glucose regulation. So we're finding that this holistic approach is not only better for individuals, it's more efficient and it's more cost effective.
I had prostate cancer 4 years ago, and if they didn't make the appointment, I would have just brushed it off. They said the PSA was like 6.5. I said, well, that's not too bad. And then 3 days later, I got a call that they made an appointment for me to see a urologist. Then they found the cancer and bingo. It could have saved my life for all I know.
It promotes the idea of a holistic approach because we have all these specialties in one location, so the patient does not have to travel to different sites. They can see their primary care provider, and the primary care provider can refer them to these specialties.
In my community, seeking counseling or mental and behavioral health services is a bit frowned upon. I'm glad I found Treasure Coast Community Health for that service because it's a no judgment zone and it helps counter what I experience.
FQHCs allow individuals and entire families to receive integrated care from highly skilled, experienced, board-certified providers.
Having the pharmacy just makes it even better, in all honesty. Whenever you could do something that makes the process easier. So having a pharmacy right on site, it's like Treasure Coast Community Health has heard what we need.
Treasure Coast Community Health provides affordable, quality health care to its community. Originally serving small citrus and ranching populations, TCCH expanded into an FQHC with 8 locations, serving the entirety of Indian River County in Florida.
So my parents, they came to Fellsmere, Florida as migrants. They worked in the agriculture and the only care they knew was Treasure Coast Community Health. And as Treasure Coast Community Health opened the doors to all the migrants would bring their children. And that's how I started receiving care at Treasure Coast Community Health 25 years ago.
TCCH believes in health care for all, designing and innovating its facilities, programs, and community efforts to ensure its neighbors have access to the best quality of care.
So the care that I've received at Treasure Coast Community Health started since I was born. 25 years later, I am still here receiving care from Treasure Coast Community Health. The quality care that I've received has been amazing throughout the years, and that's why I'm still here with them, and I don't plan on receiving care anywhere else. My 1-year-old was diagnosed at a really young age, and at 2 months she was diagnosed with something I would never imagine, and so they actually saved her life, and I will continue bringing my child here.
To find out more, visit www.tcchinc.org.